Peer Initiative started out as a high school program, 2015. We had experienced the year before the loss of several students in a short time period, and we wanted to do something about it. We've made some amazing partnerships. Here in Southwest Louisiana, we've partnered with McNeese State University with the psychology department and their community clinic, the K-Dory Clinic. They train our students in peer support. At any given time, 1 in 20 students is going through some sort of suicidal ideation. The challenge is to identify those students before they reach crisis stage and get them the help they need. Not only are our students identifying teens in trouble, but we're able to connect those teens with mental health care services that can make all the difference for them. The toughest part of what we're doing is that mental health and suicide prevention both have a stigma associated with them. People don't like to talk about it, and you can't solve a problem you don't talk about.
Even though we were losing students to suicide, people in our community just weren't ready to talk about it. They were not ready to use the word suicide because it wasn't going to happen to their kid. That was the first hurdle, was getting people to accept that this program exists, identify what we do, and then support it. And so that's why we've seen the evolution of the Pilot Club at Sam Houston. I mean, we have over 100 club members who just want to be a part of making a change.
I got involved with Peer Initiative because I had lost my cousin to suicide around the same year that I had joined, and so it kind of impacted me to want to make a difference. As a peer support team member, the kind of signs we look for would be grades dropping, a change in personality. Someone can go from being really happy to really sad, or someone who's really quiet can go to being really talkative. Any small change is a big change for us because that's something we notice and we look for.
I've done assist training from Shreveport to New Orleans. I've done Safe Talk training across Calcasieu, Beauregard, the Baton Rouge area, and we're getting there, but the need is there. It is the second leading cause of death of our teens, and if we continue to ignore it in our school systems, in our school communities, we're going to continue losing students to suicide.
I really do think that this generation is one of the more open generations. You don't really have that, mentality of you're a guy, you can't cry type thing. And so I think it's really good to see some of our guys out there, some of our football players out there talking about how they struggle with things. And I think it makes other people realize that they're not alone. And that's really important.
There is a continued need for Peer Initiative to continue to grow throughout the state of Louisiana. We feel very strongly that our schools are lacking the resources to help our students with their mental health needs, and also adequate resources to bridge them to professional counseling if it is needed. Through these partnerships and through Peer Initiative being local and boots on the ground in these schools, I think that is going to break down those barriers and it allows more students access to mental health care.
When you start out at grassroots like we did and small, you have to fight to have your voice heard. You have to fight to have other people recognize, one, that there is this issue of teen suicide, and two, that there's something we can do about it. Because of the recognition that we've gotten through this grant, all of a sudden we're not having to fight as much to have our voice heard. It's humbling, but it's also amazing that people are reaching out to us as leaders on this issue.